Hi, I want to answer the question, what can I do to age more gracefully, and what labs can I do to learn about my body and how it should work? So recently it's been brought to my attention that we should know what our blood sugar is. We should know what our vitamin D levels are. We want to know if we're as a female, we want to know if our estrogens are within normal balance. As a male, we want to know if our testosterone is in good balance. So these are hormonal tests that you can run at a lab and get your blood work value confirmed. So when you're looking at vitamin D, you may need more or less. For instance, my vitamin Ds were perfect and spot on, and I've been taking tons of vitamin D, and I don't really need to take a ton of it as much as I thought I did because it's level. It's one thing that I noticed is the glucose was higher than I want my glucose to be. Now, if your glucose is high and sustained for a long period of time, then you're going to affect your pH balance. If you're going to have high pH or low pH, you want to be at 6.8 pH value. You want to stay alkaline because you don't want your body to have a cellular environment to cultivate disease or cancer. So the reason labs are so valuable is they can measure you and how you're doing with your anatomy, and if you're doing a good job at your aging, and are you setting the stage for a healthy future. So the big premise of my practice is prevention. Although many patients come in symptomatically, I really want to get people on board with how can we prevent ourselves from having disease as we age? How can we age better? So one baseline to do is to create a baseline. Get your blood labs, get your hormones checked, get your estrogen, get your T3, T4 lymphocytes, you're checking out your thyroid. Dig deeper. So because you can have very serious problems go on and have a perfect general lab conducted at your blood lab, but then find that your vitamin D is low, or if you're a male, or your testosterone is low. So it's important for you to get those baselines comprehended and understood so that you can know whether you need to reduce your sugar intake or increase your testosterone. I'm Dr. Amy Benn. If you have any questions, give me a call.